We're back. Yay! I can't remember exactly what's on the t-shirt. Tell me, what does it say on the t-shirt? But anyway, read the t-shirts. It's all about health, okay? So my name is Ida Reynolds Watson, and I am here to tell you a story. I'm going to start with, first of all, I had a lot of different thoughts about how I wanted to introduce our guest speaker today, but I thought it's best to just tell a story. In the Bible, there are many references to fasting and prayer. Well, I prayed to God to help our family, and in particular, my granddaughter, who at the age of 14 had developed a severe chronic condition of rheumatoid arthritis. It was so severe, at 14, they would normally call it juvenile rheumatoid arthritis, but hers was so severe, it was this full-blown rheumatoid arthritis. So in August of 2020, 3 generations became patients of TrueNorth Health Clinic. My dear friend Michelle Doms had told me about Dr. Alan Goldhamer. So then I researched all about him, the founder of TrueNorth, and found that he was a pioneer and a visionary regarding the health benefits of water-only fasting, supported by a whole food plant-based diet. The intake process is unmatched. And I say it's unmatched because I personally have been on a 15-year journey seeking health, a whole food plant-based diet, and had attended several health institutions over the 15-year period in which, they provide a pretty good programming, but what TrueNorth does was extremely impressive. I learned that a member of his medical staff specialized in helping rheumatoid arthritis patients. So in August of 2020, we went, and 21 days later, we were all 3 transformed. 2 years later, my granddaughter is now pain-free and with no drugs. She's 17 years old now. My daughter maintains a largely vegan diet, and my blood pressure, and I remember I told you I was on a 15-year journey of a vegan kind of plant-based diet, but my blood pressure was average 125/70. But after my 21 days at TrueNorth Health Clinic, my blood pressure averages 90/60, and that's 2 years later, and it's pretty consistent. I want you to know that there in Netflix, there's a documentary on fasting in which the TrueNorth Health Center is featured. So if you want to get an idea of what it looks like and what the program is all about and other testimonials, I highly recommend that you take a look at that. And secondly, there's an amazing interview with Dr. Goldhamer on YouTube video with Rich Roll, who himself is a convert from a meat-eating situation to where he's whole food plant-based and an ultra-marathoner. The interview is phenomenal. It's an hour and 45 minutes. Every minute is worth watching. I highly recommend that. And then finally, I want to have you to just research Dr. Alan Goldhamer. Google him. And there are other things that he's offering. He's written a book called The Pleasure Trap, and he's provided other things to help you to understand why we're wired the way we are and how it can help us to manage our addictions to a standard American diet and move you from that to a whole food plant-based diet. And so today, you get to hear firsthand from Dr. Alan Goldhamer himself in terms of his vision and pioneering work at TrueNorth Health Clinic. And to that, here's Dr. Alan Goldhamer.
Hi. So we have a problem. This slide says 2/3, but actually currently it's about 70% of people in our society are overweight or obese. And they're developing diseases, including cardiovascular disease and diabetes, autoimmune disorders, and cancer. And the cause of this problem is that people are over-consuming calories. They eat too much. And they develop fat, and particularly visceral fat. Visceral fat's the type of fat that accumulates around your abdomen, around the organs, and is associated with the production of inflammatory markers that cause these diseases of dietary excess. And the reason people are overweight is because they're eating highly processed foods that contain chemicals that stimulate dopamine in the brain. Dopamine is the neurochemical associated with pleasure. The more dopamine, the more pleasure. The more dopamine, the better food tastes. That's what tasting good is the result of certain chemicals in the food that stimulate dopamine production in the brain. The chemicals that cause this reaction are sugar, oil, and salt. Sugar, oil, and salt are not food. They're chemicals added to food. They're hyperconcentrated food byproducts that are put into food for the purpose of stimulating dopamine production in your brain, making the food taste good. The result is that people are caught in a dietary pleasure trap. They're addicted to the artificial stimulation of dopamine that's produced in the brain as a result of these chemicals put in their feed. It works in humans. It also works in animals. If you take rats or mice, give them ad libitum exposure to rat or mice chow, they'll get to a certain size. But you put these chemicals in the feed, they'll gain 49% of their body weight in 60 days. The rats and mice are getting fat not because of psychological reasons. It's not because mommy rat didn't love them. Daddy rat loved them too much, or they had stress of having to go to work or something. It's biological reasons. You artificially stimulate dopamine production in the brain, they will overeat. They will fool the satiety mechanism, they'll overconsume, and they'll get overweight. And then they'll develop the same diseases we do. It's called the pleasure trap. If you really want a detailed explanation of this, get this book and read it. It's a disturbing book. It will not tell you what you want to hear. It'll tell you what you need to know to get and stay healthy. Today, as a result of the pleasure trap, 93% of all the calories consumed by people in industrialized countries comes from either animal food or highly processed fractionated foods. The salt, the oil, the sugar, the hyper-concentrated food. 7% of calories comes from fruits and vegetables. Now, some of you, being vegans, are looking at that and thinking, well, there's still hope. 7% after all. Keep hope alive. Well, you know, that 7%, a third of it is just one vegetable, potatoes, served almost exclusively as French fries and potato chips. Do you know that today, fruits and vegetables, whole plant foods, don't even make a statistically significant percentage of the diet of most people? They are the decoration on the plate. Humans evolved in an environment of scarcity. In a natural setting, most humans didn't survive. They died from starvation or predation. They did not live to reproduce. They were called the losers, and they were not your relatives. Your relatives were the winners. They're the ones that got enough to eat, didn't get eaten, and they lived long enough to reproduce and pass their genes on. In this environment of scarcity, your brain was perfectly designed in order to help you get enough to eat and not get eaten. The goal was to eat as much as you could eat, whenever you could eat it, of the most concentrated foods available. That's how you're designed. So the more concentrated food, the more dopamine production, the chemical in your brain that tells your body, hey, that's a good thing, keep it up. And that system of environment of deprivation eventually and relatively recently changed. This is the brain of a modern human. This is the brain of an ancient human 100,000 years ago. And what can you notice about those two brains is that they're identical. According to anthropologists, 100,000 years isn't enough biological time to see significant evolutionary change. And during that last 100,000 years, the brain that you have today is the same brain as your ancestor 100,000 years ago. In other words, a child, if you could get a child that was born 100,000 years ago, bring it somehow to today and raise that child, it would be just like your children. You wouldn't be able to tell the difference. They'd be just as obnoxious when they're teenagers. They'd have just the same problems. If you could take a baby from today back to 100,000 years ago and it would be raised by that family without any discernible difference. So the point is, your brain was perfectly designed for an environment that it evolved in for millions of years. This is the environment that your brain lived in 100,000 years ago. It was designed for this environment. Now, just a few years ago, biologically speaking, now, by the way, in that environment 100,000 years ago, that's kind of the food you might have been eating. Now you live in an environment where we changed the environment. Industrial Revolution a couple hundred years ago, we changed things. And amongst the things we changed is the food we eat. So now the food we eat is processed in places like this and often looks something like that. Now I have to ask you, can you tell the difference? Do you notice any differences? Well, that difference is why people are fat, sick, and miserable. It's why even vegans have significant health problems. They may not be eating meat, fish, fowl, eggs, and dairy products, but they're still eating a lot of highly processed, fractionated food. And that's why even taking the step of becoming a vegan, as important as it may be, particularly for the environment, for your moral, ethical, and spiritual well-being, it might even help you get into heaven, but it won't delay how quickly you go there unless you also get rid of the salt, oil, and sugar, the highly processed fractionated foods that are causing people, both meat eaters and vegans, to maintain extra weight and thus visceral fat, and then the inflammation, and then thus the diseases. So what's the solution? Well, focusing on diet, sleep, and exercise, the things you can do something about that make a difference. Eat an exclusively whole plant food diet without the added salt, oil, and sugar. So a vegan, SOS-free diet. Limit your feeding window to 8 hours a day so that you can have a period of 12 to 16 hours every day of fasting. To do that, you don't eat 3 to 4 hours before you go to sleep. And maybe you delay breakfast until you've had a chance to do some vigorous exercise. If you do that, you have a period of 16 hours of fasting every day. Cumulatively, that's thought to be highly beneficial. Today, I want to talk about another type of fasting, though, in detail, and that's prolonged water-only fasting, because that's something that we do at TrueNorth Health Center. We do some research on that, and I've got some exciting new information to share with you. A whole plant food diet would be a diet that includes fresh fruits and vegetables, whole grains, legumes, nuts, and seeds. So a whole plant food, SOS-free diet. What it doesn't contain would be meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. Now, it's really important when you describe that to say it very quickly. It doesn't seem like you're giving up as much then. When you describe what you eat, you should say, fruits, and then name them all. Apples, bananas, cherries, cherimoy. Just go through the whole list. So what if you're caught in the pleasure trap, though? What if you're caught in the pleasure trap and it's difficult to make choices, even though you intellectually know it's the right thing to do? Is there anything you can do to escape the pleasure trap? And there is. We talked about narrowing your feeding window and fasting. It turns out that the complete absence of all substances except pure water in an environment of rest is a highly effective way of escaping the pleasure trap, whether it's quitting cigarette smoking, drinking alcohol, utilizing drugs, or if you're addicted to the artificial stimulation of dopamine in your brain that comes from chemicals added to your food like salt, oil, and sugar. So people say, well, how is it helpful at quitting smoking? Now, if you ask any smoker that's quit smoking during fasting, they'll tell you by the end of the second or third day of fasting, there's no cravings for nicotine. People say, yeah, well, sure, they're so miserable from the fasting, they don't even think about the cigarettes. That's not true. What happens is that part of the process of fasting just rapidly facilitates the elimination of those accumulated materials, making withdrawal somewhat easier. So is everybody a candidate for fasting? How do you know if a person would benefit from a long-term period of water-only fasting? Really, the only way to do that is with a medical history of physical exam and laboratory evaluation. Medical history, physical exam, and lab give you the information both to determine people that shouldn't fast, and we'll talk about who those people are, and also useful tools and information to use in monitoring fasting to ensure that it's safe and effective. So who are people that shouldn't do long-term water-only fasting? Now remember, when I talk about long-term water-only fasting, I'm talking about periods from 2 to 40 days. So we're fasting people on water only for up to 40 days. Well, people that are pregnant or lactating don't want to do long-term fasting because if you're lactating, you will lose your milk production. People with a neurological condition called anorexia nervosa, where they think they're big, but they're actually very small, not a good idea to use fasting. Type 1 diabetics don't make insulin, and so they're not able to fast because you need insulin to adapt to the fasting process. Type 2 diabetics do great with fasting because they actually have more insulin than the normal person, not less. It just doesn't work because of insulin resistance, and fasting reduces insulin resistance. Why do people get type 1 diabetes or juvenile onset diabetes? Do you know that one of the common causes is the exposure to dairy products? So the theory is that when you take genetically vulnerable kids and give them milk when they're young, the body's immune system gets activated and attacks the islets of Langerhans in the pancreas that produce the insulin. And so it actually is caused by exposure to milk proteins. Cultures that don't use dairy milk have a much lower incidence of insulin-dependent diabetes. There's also viruses that people can get that can sometimes be a factor, but I think even now the American Pediatric Association warns about feeding unadulterated whole milk to kids under 2 because of this risk factor. If you've had a recent stroke, myocardial infarction, DVT, pulmonary embolism, or you have cardiac instability, atrial fibrillation, you're likely on anticoagulant therapy. You don't want to just arbitrarily discontinue anticoagulant therapy because it can result in throwing a clot and having a stroke, and you can't safely fast on that medication. As a consequence, these patients need to be weaned off and be stable for a year before undergoing water fasting. If you have severe kidney disease, remember most of the detoxification in your body is done when the blood is purified by the kidneys and it's eliminated in urine. That's what urine is the ability to get rid of those active metabolic products. It's not the bowels. The bowels are all the stuff that never got absorbed into the body. You put stuff in your mouth and it goes through your digestive system, and eventually, if you're lucky, it comes out a hole at the other end. None of that stuff is in your body until it gets absorbed through the intestinal mucosa, which we'll talk about later. So it's the kidneys that are the main detoxifying organ of the body, and the kidneys have to be functioning at a certain level in order for us to be able to do fasting safely. And so we monitor things like creatinine and glomerular filtration rate and other things to ensure that a person's a good candidate. If you have certain genetic defects like porphyria or MCAD, which is medium chain acetocoenzyme A dehydrogenase deficiency, that means you can't break down fatty acids. Fasting wouldn't be for you. If you take patients that have MCAD and try to fast them, they would develop severe vomiting and then they would die. And that would be a really bad for our outcome data. So we don't do that. If you have deficiency, depletion, or cachexia, probably doesn't make a lot of sense to do fasting where your body is dependent on utilizing your reserves. If you have on medications that can't be safely withdrawn, then you'd have to wait until you can get off the meds to be able to do the water fasting. What's interesting is most people are not medicated for their diseases. They're actually medicated for their diets. People that are on high blood pressure medication are being medicated because the diet that they're on is causing their blood pressure to be high. As soon as you change the diet, blood pressure starts coming down. In fact, we have run into problems. Sometimes you have to really aggressively withdraw medications once they go on a whole plant food, SOH-free diet, or they're on too much medication, and that can shut down the system and be a problem. And if you can't rest, you shouldn't fast. People say, well, wait a second. If you're active and exercising, wouldn't you lose more weight? And you would, but it wouldn't be more fat. It would be more muscle because you'd be forcing a process called gluconeogenesis where the body breaks down muscle in order to get glucose. In fasting, as we'll learn, the body's preferentially burning fat, and particularly visceral fat. But if you're too active, that ratio will convert where now you'll be burning fat, but you're also burning more muscle, and we're trying to avoid that. So what conditions would be favorable to fasting? Not surprisingly, the conditions caused by dietary excess and obesity. So obesity and visceral fat, elevated blood lipids, high blood pressure, cardiovascular disease in general, type 2 diabetes, and its associated metabolic syndrome, lymphoma and other types of cancer, GI imbalances and microbiome imbalances, autoimmune disorders, and addictions and dependency, including dependency on salt, oil, and sugar. So the conditions of dietary excess are the ones that respond most dramatically to fasting, and happens to be the conditions that we admit. and that we work with. I've had 21,000 patients undergo water-only fasting in the last 40 years at the TrueNorth Health Center. And we tend to focus on the people that are going to have the best results, and the people that are going to have the best results are the people that have conditions associated with dietary excess. So we fast people, as I said, from 2 to 40 days. Average fasts are 1 to 3 weeks. Sometimes it may take multiple fasts to resolve the condition, depending on how bad a condition a person's in. So the question is, well, wait a second, is it safe? Is it really safe to water fast? And to answer that, the only way you can really answer that is if a fasting safety study were done, and that's exactly what we did. Most people have a knee-jerk reaction to thinking that fasting would not be safe. In fact, most people think if you got on a plane here in South Bend and you were to fly all the way to California, that you would probably die over Colorado from starvation if you didn't get the pretzels. They really think that bag of pretzels would probably save their life. So in order to answer the question, is fasting safe, we did this fasting safety study. It was published in 2018. It's the first comprehensive evaluation of fasting safety. And what we did in this study is we took every patient, every day, every symptom. And we rated each and every symptom of every patient every day according to the common terminology criteria for adverse events from the American Cancer Society. And each symptom was given a grade. Grade 1 were mild symptoms, maybe low back pain, headache. 2, more moderate, maybe nausea, dizziness. Number 3, most common medically significant event would be a hypertensive crisis, of blood pressure over 160 systolic. Grade 4 would be some kind of potentially life-threatening thing, something where you had to take action or it could be fatal. For example, if electrolytes became too low and you didn't correct it, that could eventually become a serious problem. And number 5 is the easiest to evaluate, and that's death. Now, obviously, people only get to have one category 5 event because they're dead. So we took all these symptoms and we found there were 5,949 adverse events that occurred in our patients over a 5-year period. Now, most of these were category 1 and category 2 events, which you would expect because these are the normal symptoms of fasting: the low back pain, headache, nausea, irritability, skin rashes, the detoxifying symptoms that go on in the body when you withdraw food. There were 310 what are considered medically significant events, most of them which were hypertensive crises. As I said, anytime your blood pressure is over 160, that's considered an adverse event. So if a patient comes in and their blood pressure is 220 over 120 and they're capped out on 5 medications, and the next day it's gone from 220 down to 200, and the next day it's gone down to 190, and the next day it's 180, next day it's 170, every one of those days is an adverse event. Independent of the fact that it's clearly correcting, it's just an arbitrary standard. And in fact, 95% of those events are exactly that, people with hypertension that are correcting. There was only one category 4 event in these 5 years, and that was a hyponatremic event. Somebody's sodium went low. Wasn't a problem, easy enough to correct because we're monitoring for it. But if you weren't monitoring for it, it could have been significant. No deaths during that time. So the majority of adverse events, according to this study, were mild to moderate. They were, most of them are known, expected symptoms of fasting. And interestingly enough, there was no significant increase in the severity of adverse events based on age. So up until this time, no human subjects committee would approve a study on fasting for really old people, like over 65. How many of you are over 65? Yeah, you're too old. Now we know, though, if you're 65, you're 75. There's no difference in terms of significance. So now, not only can we conduct studies with older individuals, but so can any other research facility if they use this as justification. The conclusion of the TrueNorth Health water-only fasting protocol as implemented at the TrueNorth Health Center is safe. Now be clear, each of these patients goes through a medical exam, laboratory monitoring. They're seen twice a day by our staff doctors. They're carefully monitored. Fasting not in a controlled setting, not appropriately monitored, could be problematic. So we published a study recently. This is a new study, water-only fasting in the treatment of stage 1 and stage 2 hypertension. It was done with our colleagues at the Mayo Clinic. And we looked at, again, using the same standards from the CTA, the safety standards, we looked at what happened to these patients in this prospective study. So there were 30 participants that were enrolled in this study between the ages of 30 and 75. They had hypertension with systolic blood pressures ranging from 130 to 180, diastolic from 80 to 120. They fasted at least 7 days and then went through refeeding of at least 3 days. And we collected their data before fasting, at the end of fasting, at the end of refeeding, and then we flew them back for evaluations at 6 weeks. And just this week, we finished what's actually a 1-year follow-up that'll be coming out next month. But this involves 6-week follow-ups. So you can see here the data. 67% were female. Average fast was 11 days. The fast ranged from 7 to 40 days. And average refeeding length was 5, ranging from 3 to 17 days. We looked at the adverse events, again, according to exactly the same criteria I gave you before, and we found there were 315 adverse events in these 30 subjects. Most of them were these grade 1 mild, some of them were the grade 2, and only 9 were grade 3 events, no grade 4, no deaths. Of the 9, 8 people had 1 event, 1 person had 2 events, and these were, again, hypertensive crises, quote, where blood pressure is over 160. None of them lasted more than a day. Most of them are related to people withdrawing medication. The blood pressure goes up and then comes down, and all of them resolved. So these are some of the kind of symptoms that you get with fasting. You notice that of the 30 subjects, 16 had nausea. So half the people will go through a period of nausea during fasting. Pre-syncope dizziness. So if you get up too quickly, you can feel dizzy. Changes in blood values, headaches. 10 of the 30 subjects had headache. The most common cause of headache is actually caffeine withdrawal. If people have been coffee drinkers and they go withdraw from that highly addictive nervous system stimulant, they will get some headaches. Sleep disruption, GI symptoms. You know, I always remember I had a patient referred to the center one time. She was an older woman with autoimmune disease, hypertension, on a bunch of medications, and her doctor had sent her in telling her that we could do something to help her with her rheumatoid arthritis. And I said, yeah, we might be able to help you with that. And she said, you know, I've known this doctor for 20 years, and I really love him, but he's such a kidder. He said you were going to put me in a room and not feed me for 2 weeks. She thought that was the funniest thing. Yeah, I told her it'd be at least 3. And she said, but 3 weeks with nothing to eat except distilled water? What would happen to me? And I said, well, first your mouth will cut up and taste like something crawled in there and died. And then you likely have some headache, low back pain, irritability, nausea, vomiting, you may have some skin rashes. Finally, she interrupted me. She said, well, my, you're quite the salesman, aren't you? She ended up fasting 26 days. I'm telling you the story, so obviously she had a good result. It wouldn't be a very good story if it was like, yeah, nothing happened. No, she did well. She goes back to see this doctor, and when he saw her for the first time, he immediately called me. And he said it was the most amazing thing he'd ever seen in 25 years of medical practice. And, you know, she had done just phenomenal. And he said the one thing he didn't understand was that she just told him that we fasted her on water only for 26 days. How did you get her to do it? And I said, well, you know, she was so reluctant. What we finally decided to do was just tie her up. He said, you did not. And he turned to her and he said, did they tie you up? And she said, well, not till after the 2nd week. You know, he quit his job and joined our staff because he said he wanted to finish his career doing something worthwhile with his life. As I said, there were 9 grade 3 events. 8 participants had 1 had 2, 8 were hypertensive, all resolved within a day. 1 had decreased white blood count. Not clinically significant, but still, you know, gets graded as a stage 3 event. So here's some statistics that show the BMI is just a measure of overweightness. It was reduced and sustained at 6 weeks. All these are statistically significant. Abdominal circumference goes down and stays down. Systolic blood pressure drops and stays down. Diastolic blood pressure drops and stays down. Antihypertensive medications, you can see that people were on drugs before. After fasting, 26 people of the 28 that completed the study were not medicated. There was 1 that still had some medication, but at half the dosage that they were at baseline. So 28 out of 30 completed it. No grade 4 or 5 events. Medication usage at 6-week follow-up was sustained, and markers of cardiovascular disease were all statistically significantly impacted. And this was published, this is the first paper, was published in Nutrients just recently, done with our colleagues, as I said, at Mayo. We have the second paper, which I'm really excited about, looks at these people. That was the end of the study at 6 weeks. Then what we did is, without them knowing it, we continued to track them, and at 1 year we followed up with each of those participants. And to see whether, without any ongoing support, they would sustain their weight loss, their blood pressure, and their medication use or lack thereof. And the psychologist on our staff, Dr. Doug Lyle, who's like one of the smartest people I've ever met, predicted that somewhere between 5 and 10% of people would be able to sustain that without additional support over the course of a year. And it turned out the majority of them did. So he was off by a factor of 10-fold. So that was like one of the best parts of the study, is that I was right and he was wrong, because I had predicted that a third of the subjects would be able to maintain it. It turned out even I was underestimating the capacity of people to maintain diet and lifestyle change. So we have that study will be coming out later in the year. We're very excited about that. This was a second study. This was a study looking at the effects of water-only fastings on the markers of cardiovascular disease. And it included using a DEXA scanner that we brought in to actually analyze precisely the body composition of people after fasting, like what actually happens. We know weight goes off, some weight comes back. We wanted to know how much of the weight was fat and visceral fat, how much was muscle, bone, what actually happened. And so we enrolled these subjects, and we're now able to determine that quite precisely. And this was 38 subjects, average age 60, more females than males, fasting length ranging from 13 to 19 days, refeeding as you see, and then follow-up. And these people were followed up on average 6 weeks later. So we wanted to find out not just what happened during fasting, but what happened during refeeding to body composition. What we found was, you can see this is baseline, end of fasting, and then on follow-up, so at 6-week follow-up. What we found was that weight went down during fasting, and it stayed down in a statistically significant way. The lean mass, if you looked at how much lean tissue there was before the fast, and then you looked at how much lean tissue there was 6 weeks follow-up, there was actually more lean tissue at 6 weeks follow-up than there was before we started fasting. If you looked at the fat mass went down precipitously, and particularly visceral fat, the fat we talked about being most detrimental, went down preferentially. And I'll show you some numbers on that. Interestingly enough, the bone mass, which you might be worried about because people are resting when they're fasting, bone mass was the same at 6 weeks follow-up as it was at baseline. So no loss in bone mass, a gain in lean tissue, and a loss in fat. So basically what we learned was that you lose a bunch of weight during fasting, you regain a bunch of weight when you come off the fast, but the weight you regain when you come off the fast is water, glycogen, fiber, and protein. And the fat loss continues. And I'll show you some charts later that kind of make that really graphic. Clinical risk factors of cardiovascular disease were all significantly reduced at follow-up. So people maintain the drops in cholesterol and lipids and triglycerides, etc. The HOMO-IR that was increased at the end of the fasting by the time you got to 6 weeks follow-up, HOMO-IR as a measure of insulin resistance, had dropped and was able to maintain. And fatty liver index is also a measure that's used to measure liver function and health, was significantly improved at follow-up. Continuous visceral adipose tissue loss throughout the intervention and at follow-up. So the fat continued to go down even as the weight was coming up after fasting. Here's an example of one individual with the DEXA scanner. This is an individual who fasted for 15 days. You see their DEXA scan at baseline afterwards. If you look at the magenta line, that's the lean tissue. You notice you lose lean tissue when you fast, but then it comes back up during refeeding. The black line is fat. Fat loss goes down when you're fasting, and it continues to go down. And in fact, if you look at this graph, you see the person total weight loss was around 12%, 13% of body weight. They lost about 18% of all the fat on their body, but they lost 54% of all the visceral fat on their body. The ratio of visceral fat to fat was 3 to 1. So there was this preferential mobilizing of visceral fat, much more so than, say, going on a diet or going on the dead Dr. Atkins diet, or which the ratios have been evaluated. You know, Dr. Atkins advocated a high protein, high fat, animal-based diet. for the purpose of short-term weight loss. May his fillet of soul rest in peace. Who died at 268 pounds from cardiomyopathy, but at least he was not a hypocrite. He did stick to that diet till the day he died. And lean tissue was 4% of lean tissue was lost, but that was regained and then some after 6 weeks. So high blood pressure, the leading contributing cause of death and disability in industrialized countries, turns out to be responsible for congestive heart failure, where your heart muscle loses integrity. So if you lie down, your lungs fill with fluid. So these patients have to start sleeping sitting up or drown in their own fluids. That's caused by high blood pressure. Strokes, where people lose both, tremendous function as a consequence of stroke. Also, a major cause is high blood pressure. Do you know that 40% of people over 25 are now hypertensive? And 63% of people over 60 now have hypertension? That means if you don't have high blood pressure, you're abnormal. You might say, well, then why don't we just give everybody hypertensive drugs? Why don't we put it in the public water supply? Well, you wouldn't want to do that because it turns out those drugs are very dangerous and they can kill you. And the only reason why they wait until your blood pressure is quite elevated is because the death from medications would exceed the people saved, unless you wait till the blood pressure is high enough that the death from stroke is offset enough to offset the death from the medications. Medications, hypertensive medications, despite their danger, are one of the leading justifications for prescription medications. They're worth billions and billions of dollars to the medical industry. Unfortunately, they're very ineffective in the sense that most of the people dying from the effects of high blood pressure die at levels with blood pressure not high enough to justify the risk of the medication. For example, if your blood pressure is 138/88, the risk of dying from medication may exceed the benefit. So they wouldn't normally give you blood pressure medications, but your risk of dying of a heart attack is 5 times that of a healthier level at 110/70, and significantly higher than a person who has healthy blood pressure, which is probably on average closer to 90/60. For every point you drop your blood pressure through diet and lifestyle, not drugs, but diet and lifestyle, you reduce your all-cause mortality 1%. And that risk reduction, as I said, probably goes down to somewhere around 90/60. But that's how we treat blood pressure medications. 1, 2, 3, 4, 5 medications. They have significant side effects, not just chronic cough and fatigue and impotence, but also death. The thing about blood pressure medications is they can give you one promise with absolute certainty. They will tell you when you get your medications, you will be taking these drugs for how long? Forever. That's right. They guarantee you you'll be on these drugs forever because you'll never get well. They promise you if you do what you're told, you'll be sick forever and you'll never get off of them. So what does work at lowering blood pressure? We know that weight loss does. For every kilogram of weight you lose, there's a 1.2 drop in systolic blood pressure. So a bunch of weight loss sometimes helps bring pressure down, as does a vegetarian high-fiber diet independent of weight loss. Just eating more plants helps bring down blood pressure, as does not drinking. Now, people are often told alcohol is good for them. If they don't drink, they should start. Haven't you heard that? Oh, it thins the blood, reduces your risk of stroke, right? And it's true, if you're on a greasy, fatty, slimy, dead, decaying, flesh-based diet and at risk for a clotting stroke and you drink alcohol, there's a blood-thinning effect of alcohol, very much like aspirin. So it slightly reduces your risk of having a clotting stroke. It doesn't reduce your risk of dying because you have an increased risk of a bleeding stroke. But if you'd rather die of a bleeding stroke than a clotting stroke, maybe alcohol is for you. Alcohol is also a wonderful source of calories, 7 calories per gram, which is why men get those really attractive beer bellies. Oh, and the plumber's crack that women like so much. Yeah, they had to make the pants right up higher because they were going crazy. Exercise will lower blood pressure almost as effective as medication. Medications will lower blood pressure and reduce the risk of stroke for those with the highest levels of hypertension. But of course, as I said, there's side effects from that way of lowering it: chronic cough, fatigue, impotence, and death. A combination like John McDougall did at the St. Helena Hospital will result in lowered blood pressure. And that was pretty good until we did a study with T. Colin Campbell from Cornell, where we have the largest effects that have ever been shown in treating high blood pressure in humans, with an average drop of 37 points. And if you look at stage 3 hypertension, the average drop is 60 points, plus whatever effect baseline medication modification from drugs may have been having. And that was published in a paper, Medically Supervised Water-Only Fasting in the Treatment of Hypertension. We've published a second paper after that, medically supervised water-only fasting in the treatment of borderline hypertension. These are people that didn't have pressure enough to justify the risk of medication, but were still at risk as a consequence. And not surprisingly, their blood pressure in this study involving 68 subjects was similar. The fasting ranged from 5 to 40 days. All the subjects normalized their blood pressure and was quite effective. As a result of publishing those first two studies, we were approached by the International Union of Operating Engineers, California's largest and most powerful labor union. And they invited Dr. Lau and I to present our data with the idea of maybe making fasting a covered benefit for their members. And I remember we went to a meeting and we presented our data, and there were some skeptics, particularly the construction guys that own the companies that hire the union workers, because they were upset that they already paid so much in medical benefits. And as one guy said, now you want us to have to send them on some resort vacation. And I explained to him what happens to people when they're fasting, the headache, the low back pain, the irritability, the nausea. And he said, okay, fine, it's not a vacation, but they still objected. There was a reviewer there from the NIH, the National Institute of Health, and he had reviewed the data. He said that he thought it would actually save them money in reducing the heart attacks, the strokes, having to cut their feet off for the diabetes, etc. And so a little bit of debate went on, and the greatest problem I had was when the actuary that calculates the cost of everything got up and he said, excuse me, Dr. Goldhamer, but if we do this program, won't it dramatically increase our retirement costs by making them live longer? What do you say? I'm like, I don't know what to say to that. And a guy stands up, and I know he's a crane operator because his neck's like twice as big as my thigh. And he said, listen, little man, you need to remember who you work for. He said, you work for us. He says, why don't you do some calculations about how much money we're going to save when I come back there and break your neck? Then they voted unanimously to make our program a fully covered medical benefit. But they asked us to do a study to figure out if they actually saved any money. And so we did a study. We took the first 30 consecutive union members. They fasted an average of 3 weeks. They lost 26 pounds. At 1 year follow-up, they were down an average of 28 pounds. They dropped their blood pressure 30/11, and they had sustained much of that result. And the union found they saved more money in the first year than the entire cost of the program, just in reduced pharmaceuticals and hospitalizations. So we went on for over a decade working with this union, treated over 100 of their members with diabetes and hypertension, and were able to get significant results. So then the question is, what's actually happening in fasting? Why is it that doing nothing, essentially, is having a bigger effect than doing anything? Well, one thing is weight loss. What percentage of our patients that undergo water-only fasting do you suppose lose weight? All of them? Well, that sounds kind of quacky, doesn't it? The 100% effective. Well, it turns out it's true. You don't fast, the laws of physics and thermodynamics tell you you're going to lose weight. Now, I did have a woman one time said she wouldn't lose weight. I said, what do you mean you won't lose weight? She said, no, I've been on all these diets, I never lose weight. I said, well, are you going to lose weight here? No, she won't. I said, look, what do you think? You're going to violate the laws of physics and thermodynamics? And she said, yeah. She goes on the fast the very first day. Guess what happens? She gained a pound. She held some fluid, went up a pound. After that, she diuresed, lost a pound a day just like everybody else. But for that day, she felt so vindicated because she said, see, Dr. Goldhamer, even water fasting, I gain weight. Everybody loses weight. We lose about a pound a day. That's what it is. And if you rest, it'll end up being predominantly fat that you're losing, and particularly visceral fat. Natriuresis, the selective elimination of sodium from the body. People are full of salt because they're eating all this highly processed food. And that salt causes the body to hold fluid. That increases the blood volume. So that causes high blood pressure. It causes edema and swelling. It makes your joints hurt. It causes disruption in the microbiome. And as a consequence, when you go on a fast, the body selectively eliminates the sodium. And it does it very rapidly, much more powerfully than the hydrochlorothiazides or the diuretics or other things. Body will flush it out. People lose sometimes large amounts of fluid initially just as a consequence of this purging. The body also detoxifies. Are people really toxic? Like if you took a fat biopsy, would you find several hundred different chemicals like PCB, dioxin, pesticide residues, heavy metals? Would you find that inside people? Yeah, and guess how most of it got there? If we set aside smoking and drugs and stuff like that, what's the most common normal behavior of humans that results in about 90% of the total body load of toxins that are in their body? Eating animal foods. Meat, fish, fowl, eggs, and dairy products biologically concentrate poisons from their environment, and it ends up in your body. That's where it's coming from. Just choosing not to eat animal foods will dramatically reduce your background exposure to toxins. Yeah, there are some toxins that are on plant-based foods as well, especially if plants are not grown organically, but they're not biologically concentrated like they are in animal foods, where day after day after week after month, these animals are accumulating these toxins in their tissues. When you kill and eat that animal, you get its entire lifetime load of toxins. Whereas on a plant, there's not the efficient biological concentration. It doesn't mean you shouldn't eat organic plants, but your exposure is going to be dramatically reduced. And in fasting, your body rapidly mobilizes and eliminates these toxins. And that's why fasting can be unpleasant. That's why you get the metallic taste in your mouth. You get unpleasant symptoms and detoxifying symptoms. It's not always pleasant. But, as long as people have dramatically good results, we find they forgive us for that. So, in fact, this is so rapid, there are people out there going to tell you, oh no, don't do fasting, it's too rapid, the detoxification. Unless you do one thing, and that's buy their proprietary pills and potions, and then apparently it's perfectly safe. Enzymatic injection, how do you think the toxins get out? Or for that matter, how do you think the fat gets out? It's all enzymatically driven. In the case of fat, it's lipolysis. This is an enzymatically driven pathway. You have to have enzymes to mobilize those fat stores. When you go on a fast, you induce those enzyme pathways, and guess what? It persists. That means every time you fast, you get better and better. Just like every time a person exercises, they induce enzyme pathways for glycogen mobilization. You induce paths for detoxification and macronutrient mobilization. So even if it's a 16-hour fast, like every day, cumulatively, that's thought to be beneficial. And then if you occasionally do these longer medically supervised fasts, it profoundly affects that. And that's why a person that's fasted multiple times gets better and better and better, gets easier and easier and easier, just like becoming, in essence, a trained athlete, you're becoming a trained faster. And that detoxifying pathway means you're not just detoxifying while you're fasting, but the days, the weeks, the months, and the years afterward. Insulin is a hormone in the bloodstream that drives sugar from the blood into the cells where it's needed for fuel. What would happen if your insulin didn't work? Blood sugar levels would go up. That's called diabetes mellitus. That's what diabetes is, type 2 diabetes. It's not that there's not enough insulin. These patients have more insulin. It's just not working because of insulin resistance. What causes insulin resistance? Fat, but more particularly the diet that makes you fat. And the diet that makes you fat is a diet that's based on animal products and salt, oil, and sugar, highly processed fractionated foods, the hyper-processed foods. That's what makes you fat, and that's what causes insulin resistance. It's not just the fat, because think about it. Do you have to lose all the extra fat to normalize your blood sugar levels? No. People's blood sugar levels come down long before all the fat's off. You have to reduce the insulin resistance. Fasting, exercise, both reduce insulin resistance. In fact, it's interesting. If you look at all the things that happen with exercise, in terms of biological changes, those also happen in fasting, like insulin resistance. Why would fasting where you're resting and exercise where you're being vigorous do the same things biochemically? It's because both, in my opinion, both of those things do one thing in common. They get rid of the consequence of dietary excess. Exercise undoes the consequence of excess. Fasting undoes the consequence of dietary excess. And what I'm telling you is that most of the people you know that are sick and dying and suffering are suffering because of dietary excess. They're overweight, they develop metabolic syndrome, and they're getting sick as a consequence of this. And this is a way of helping reduce some of the biochemical changes that occurred from dietary excess. There's a gut. You have a tube that goes from your mouth out of the throat into your stomach, intestines, and into the rectum, and eventually there's a hole at the other end called the anus. Digestion is essentially shoving stuff in one hole and then trying to push it out the other hole. There's nothing that gets into your body when you shove it in this hole unless it gets absorbed in the intestinal mucosa through the intestinal mucosa, which is like a little fine screen. Tiny little holes. They're so small, in fact, you can't even get a protein molecule through it. You have to have it broken down into amino acid to be able to absorb it. It acts like the screen does to keep the moth out. If the hole is too small, the flies or the moth can't get through. But what would happen if the holes got bigger from damage? Would the flies get through your screen if you cut the screen? Sure. And in your gut, if you have inflammation that damages the gut lining, then stuff can leak through. It's called gut leakage. And in vulnerable people, if you leak those proteins through, at first the body's immune system will react and protect you. Because, your body's trying to protect you from bacteria and all kinds of organisms, etc. But in genetically vulnerable people, if you keep doing it, what happens is the immune system becomes confused. You have heard of the condition celiac disease? That's essentially where your body's immune system gets confused and starts to attack your own colon, or your own intestines, I should say, from the exposure to gluten. So that's why people with celiac disease can't eat gluten, because it'll cause the immune system to attack your own self. Well, it turns out that that's essentially what autoimmune disease is your own body attacking your own tissues. Like rheumatoid arthritis, that's your immune system attacking your joints. And what can trigger that is gut leakage. In the case of gluten, it's a good, interesting example. 1% of the population has celiac disease, but a lot more have what's called Hashimoto's thyroiditis, or hypothyroidism. Hypothyroidism is the same kind of condition, autoimmune. It's your immune system attacking your thyroid and taking it out of commission. Well, it turns out that there's a gene associated with that called the HLA-DQ gene. And it's the same gene that's associated with gluten sensitivity. And so the theory is, in some people, the immune system attacks the colon, you get celiac disease. Other people, it attacks the thyroid, you get hypothyroidism. Other people, it attacks different tissues. But it's still your immune system attacking yourself. The medical profession, in the case of autoimmune diseases like rheumatoid arthritis, say, well, let's shut down the immune system then. If your immune system is attacking your joints, we'll just shut it down. And at first, it's like a dream. You take the steroids, the prednisone, the methotrexate, whatever. It shuts the immune system down, and you feel better. And then it becomes a nightmare, because it turns out you need your immune system. And when you shut down the immune system, you become vulnerable to dying from diseases even worse than the autoimmune diseases you were being attacked by. What would cause this kind of gut leakage? How about free radicals? You heard of free radicals, activated oxygen molecules that can cause damage? What's a good source of free radicals? What caused the difference in the face here? Can you tell? What's the difference about these two faces? One has wrinkles. Wrinkles are cross-linked collagen tissue. It comes from free radicals. Where do you think this person got the cross-linked collagen tissues from? What do we call that face? Smoker's face. You can tell a person's a heavy smoker. They get premature aging, so their face ages out, and you get smoker's face. Do you think it just ages the face? No, it ages the whole body. That's why, for example, if you damage the enamel lining of the vessels, then you can get heart attacks and strokes. Do you know that 80% of smokers will never get lung cancer? 80%. It's almost like smoking's protecting them from lung cancer. In fact, I believe that's true. I believe cigarette smoking protects people from getting lung cancer. How does it do that? It kills them from heart disease before they live long enough to grow the tumors. Yeah, it takes a long time to grow them lung tumors, but you can die from heart disease really quickly. 80% of people that smoke. Let me ask you, if they could make smoking more dangerous so that everybody died from heart attacks, would they be allowed to advertise it as cancer safe? You have an autonomic nervous system. It controls everything in your body. You don't think about it. If you went out running and your heart didn't speed up, you wouldn't get enough oxygen flow and you would die. Do people die because they forget to tell their heart to speed up? Does that happen? No. Why? How does the heart know to speed up? Because you have an automatic or autonomic nervous system that has two branches, the sympathetic and the parasympathetic, and it automatically detects the increased oxygen needs and increases the heart rate to compensate. But if your autonomic nervous system becomes out of balance, like what's called hypersympathectonia, where the sympathetic tone is too high, you would have a symptom like constipation, because the autonomic nervous system controls your intestinal tract. When you have constipation, that can be because the sympathetic tone is set too high, which can be caused by stress and other things. If the parasympathetic is set too high, that can be diarrhea. And so basically, we have all kinds of pains and aches and problems in our life because of imbalance in the autonomic nervous system. And we've come up with hundreds of healing systems to fix it, like chiropractic manipulation, osteopathic manipulation, massage, biofeedback, yoga, homeopathy, et cetera, all these techniques that work basically. Have you ever wondered, like, how do these things work? Well, they work because of their influence on the autonomic nervous system balance, largely. And so some things may work more than others, but to the degree that you can rebalance the autonomic nervous system, you can get rid of a lot of pains and aches and problems. Well, the most powerful way to rebalance the autonomic nervous system works like rebooting the hard drive on a computer. It's like, you know how the computer's not working, you turn it off, you turn it on, you don't know why, but now it's working. Well, that's rebooting the hard drive, so to speak. Well, fasting, in my experience, is the most powerful way of rebooting the autonomic nervous system. It's like shutting everything down, you turn it on, now You don't always know why, but things are working properly again. Psycho-spiritual, do the Jews and the Jains and the Christians and the Muslims and the Hindus, do they all agree on everything? Or sometimes they're killing each other in the street around their disagreements. But there is one thing that every major religion has in common, and that's a belief and admonition about fasting. Every religious tradition, whether any of them will have tradition. Moses, David, Elijah, Jesus, go to the Bible, there's 1,100 references. Very common bond. The immune system is enhanced during fasting. In fact, in 2016, Yoshinori Ishimi won the Nobel Prize in Medicine talking about autophagy. This is the self-eating, the ability to get rid of cancer cells and breaking down cells and rejuvenation of cells. And it turns out that one of the ways to enhance autophagy is fasting, and that may be why we're seeing the results that we're seeing in cancer and other outcomes. And taste adaptation. This is a really big deal. People eat a healthy diet. They don't like the taste without the salt, oil, and sugar because they're addicts. And so when you first start eating foods without salt, it's not enjoyable. So it's hard to get compliance and adherence because people don't like it. But after fasting, good foods taste better. And we were actually able to understand now why, because we did a study on taste adaptation. We showed that in fasting, your sensitivity to salt and sugar changes, and your liking, hedonic response to salty, sugary, fatty foods changes. Good foods start to taste good. This was published in Curious Journal of Medical Science, Potential Effects of Fasting, followed by plant-based diet on salty and sweet taste sensitivity and perceived intensity, food liking, and dietary intake. Before I forget, if any of you want copies of these studies, they're all freely available on our website at fasting.org. There's a fasting compendium website for our nonprofit foundation, the TrueNorth Health Foundation. And so all of our papers that have been published, all those that will be coming out this year, are all going to be freely available to you. So the conclusion of this study was that basically fasting made good food taste better. That's important, and I can give you a great example. When we did our study with the union, the very first union guy they sent us was a guy who was a hypertensive, 220/120, capped out on medications, obese, diabetic, and he shows up, and they said, look, you can go to this place, we pay for everything, but you can't run the crane anymore until you bring your pressure down because we don't want you to die, cranes are expensive. So he shows up, and they told him everything except one detail, what the program was. He had no idea. He thought he was going to get a sixth medication. He had no idea. He looked around our facility and he said, oh, no. This is not for me. I said, no, you're here to get well. He goes, no, I'm not sick. And I'm like, what do you mean you're not sick? You're hypertensive, you're diabetic, you're obese. I said, not only are you sick, I thought this would get him. You're going to die. You know what he said? He said, yeah, well, aren't we all going to die? I mean, valid point. So I thought, okay, I got to take a different tact. I said, look, you're on $880 a month worth of medications. We get you healthy, you won't need to spend that money on medications. He said, what do I care? I don't pay for the medications. My union does. At this point, I realized this is not my normal self-selected, highly motivated TrueNorth Health patient. And I don't want to strike out with this guy because he's my first union referral. And I'm thinking, okay, what do I know about diabetic, hypertensive people on a lot of meds? Right? So I say, if we get you off all them drugs and get you healthy, we might be able to do something about your little problem. He starts to stand up, and I'm like, uh-oh, because he's a big guy. He says, why the hell didn't you just say so? So he's telling me about his diet. This is his diet, but I couldn't get a picture without the lettuce. And they said if they put that green stuff on there, he'd take that off and throw that away. So he's a triple cheeseburger guy. So we know we got to get him to eat some real food before we start fasting him. And so we give him some food from our hot bar and salad bar, and he's trying to eat the food, but he can't get the food down. He's like, and I sit down, I said, it looks like you're having trouble with the food. He said, what food? He said, this is not food. He said, this is disgusting. He said, if I have to eat tasteless swill like this, I'd rather just die. He said, why don't you go out to my truck? You get my 12 gauge, and when I'm not looking, just shoot me in the head. So we checked him in. Fasted him 26 days. He lost 50 pounds, normalized his blood pressure and blood sugar. Most impressive, though, afterwards, we're feeding him the same food, and now he's eating the food. And I said, it looks like you're doing better with the food. He said, yeah, your damn chef's finally getting the hang of it. Took him 20 minutes to convince him it was the same food that we gave him when he came. He said, no, that food you gave me when I came in was disgusting. He said, this is not bad. Prolonged water-only fasting, exclusively plant-based diet in the management of plaque psoriasis. I'm going to just go quickly through a few slides here. This is a paper was published in JICM. Can you tell the difference between before fasting, after fasting, and on follow-up? Plaque psoriasis is a tough condition. It resolves with fasting and dietary change. Fasting decreases some things, and it increases some things. It decreases glucose and IGF-1, which is a matter associated with insulin growth factor. The lower your IGF-1, the longer you're going to live. It decreases leptin, which is why there's so much reduced inflammation. It reduces blood pressure, heart rate. mTOR is a mammalian target of rapamycin. The lower your mTOR, the higher the autophagy. That may be why autophagy goes up so much in fasting, because mTOR goes down. Fasting reduces your microbial load. It reboots the gut microbiome. You have 5 pounds of bacteria living in your gut. 10 trillion creatures swimming around, eating, drinking, and defecating inside you right now. And what those microorganisms poo in your gut may determine how well your immune system works and how long you live. If they're pooing, if you're a meat eater, you have completely different bacteria than if you're a plant-based eater. Vegetarians have different organisms and a broader diversity. There's 1,000 strain of organisms in a healthy gut that help protect you. Very, very important part of your immune system. If you're a meat eater, you're going to have much higher products that are associated with cancer-causing agents. If you're a plant-based eater, you have completely different looking guts. In fasting, you can reboot that microorganism, and then by eating the proper prebiotics, that is a whole plant food diet, you can grow the normal organisms. We've actually done a study where we looked at the changes after fasting in the microorganisms. That hasn't been published yet, but it's very interesting data. Inflammation, all the markers of inflammation go down in fasting, and fasting reduces abnormalities associated with metabolic syndrome, which is what's killing most of the people you know. Fasting increases some things like adenopectin and ghrelin. That improves insulin sensitivity, which maybe diabetics are able to normalize blood sugar without having to use the medication. It gets complicated. Some things like AMPK, which is activated protein kinase, can turn down something called PGC1 alpha, which is peroxisome proliferator activator receptor, and that increases mitochondrial biogenesis. What that means is the energy producing mechanisms inside the cells actually go up during fasting, which may be why we see the results we do in chronic fatigue and some of those conditions. BHB is beta-hydroxybutyrate. That's what your brain is burning during fasting. Instead of sugar, it's burning ketones, specifically beta-hydroxybutyrate, and that increases something called BDNF, which is brain-derived neurotrophic factor. That's what protects the brain from getting Alzheimer's disease. If you take rats and you periodically fast them, they don't get Alzheimer's disease, and it may be because of the higher levels of BDNF. The other thing that increases it is exercise. Again, exercise, fasting, both having the same kind of biochemical effects. Fasting, they talk about cellular stress resistance and adaptation. Walter Longo took 30 rats, gave them enough chemotherapy to kill their cancer, but they all died. Take the same rats with the same cancer, do the fasting before and after the chemotherapy, they survive, all of them, and profoundly affect long-term survival. Because fasting makes the cancer cells more vulnerable, and it helps protect the healthy cells from the damages of chemotherapy. As I mentioned, autophagy goes up in fasting, which is how the body is able to get rid of some of these broken down cells, and the microbiome diversity, and it stimulates B cell immunity. There's tons of changes that we're just now learning are happening in fasting that are difficult to reproduce in other ways. According to Walter Longo, the combination of fasting and chemotherapy dramatically results in higher cancer-free survival. This is a particularly great case. This was our first case in the British Medical Journal. This was a woman with follicular lymphoma, which is stage 3 lymphoma, which is lymph cancer. So she comes up with lymph cancer, told she has to go through chemotherapy, doesn't want to do it, comes in, undergoes 21 days of water fasting. This is a 42-year-old woman with significant tumor base, so you could feel it upper and lower. Fasts for 21 days, loses 22 pounds. At 2-month follow-up, she loses another bunch of weight, right? Because she sticks to a whole plant food SOS-free diet. At 6 months, she's lost additional weight, and her lab tests are normalizing. At 12 months, we get a CT scan, and she's cancer-free. You can see changes here in CT. The paper is published at 1 year, but they say, look, maybe she got lucky. Maybe it was spontaneous remission. Why don't you follow her for 3 years? We follow her for 3 years, and she's still cancer-free. Now, last month I got the 6-year follow-up. She continues to be cancer-free. And we've now been treating lots of lymphoma, including stage 4 lymphoma. We keep saying the same thing over and over again. Tumor reduction, normalization in people that are willing to do dangerous and radical things like eat a healthy diet, exercise, go to bed on time, and undergo fasting. This is a case report of a dentist that got hit in the head with a pole, developed a dural tear, got traumatic brain injury, 16 years of constant daily head pain, between 8 and 10 out of 10, non-responsive to medication, 16 years of that, comes in, ends up fasting for 41 days, normalizes her cephalgia. 6 months later, does a follow-up 40-day fast, so 2 40-day fasts in a year. Now we've got, this paper was published at 6-year follow-up. We've now got 10-year follow-ups, no headaches for 10 years following water-only fasting. This was an appendicitis. This was a gentleman told he needed surgery for acute appendicitis. Instead, we put him through fasting. He still has his appendix. And again, this is over a decade later. The paper has a 2-year follow-up in the paper, but we've continued to follow him. This was hydronephrosis and urotectasis, partial regression of an unspecified pet. This is in a vegetarian. This woman had become a vegetarian, but she developed this abdominal pain, and she had high blood pressure because even though she was vegetarian, she was still eating salt. She had hypothyroidism because she was still eating wheat. She had a back pain and then developed this inner abdominal pain. So she went to the doctors, and they found out she had a tumor. They couldn't tell without a biopsy whether it was a cancerous tumor or whether it was a fibrotic tumor, but either way, they wanted to do a biopsy because it would depend on how they do the surgery. And so she decided she wanted to try to fast to see if we could get this mass to go away. Her doctors were vehemently opposed, but they couldn't get her into surgery for a month. So we went ahead, and what we had 13 days of water-only fasting, followed by 11 days of feeding, because that's all the time we had. And what ended up happening was not only did she normalize her blood pressure, lose the weight, and normalize her ureters, all the swelling and stuff went away, but the tumor reduced to the point there was nothing left to biopsy. They were pissed. Because they wouldn't do the follow-up imaging until they took her in to do the surgery because they were so confident that they'd be able to do it at the same time. And so they brought the surgical team together and they wasted the money. That was so sad for them. Water-only fasting and seborrheic keratosis. This was a woman who came in, she had a facial lesion. For some reason, she didn't like it. And she went on a fast and it fell off. So not unusual. So we have a book, it's called The Pleasure Trap. If you want a disturbing book that'll tell you what you need to know, get this book. It's available outside. Our publisher's here. If you want a signature, I'll be happy to sign it. We have 2 cookbooks that are the Bravo and the Bravo Express cookbooks. These are vegan, SOS-free cookbooks, so no salt, oil, and sugar. And the Health Promoting Cookbook are our original vegan book. These recipes are so simple, even I can make these recipes. They're well-tested, excellent, simple to use from readily available ingredients that don't use salt, oil, and sugar. No excuse anymore that you have to use these things. The information you need is there. And they're all available to you. Guys got a good pricing and all that kind of stuff on you. So get the books, use the books. And if you know a doctor that wants to do something worthwhile with their life, go to heaven instead of hell, then have them come in. Our foundation will pay for their training. We provide them room, board, and training, no cost to the doctor. Go through internship residency training so that they can learn how to actually get people well using a vegan, SOS-free diet and water-only fasting. I've probably exploited my time. If so, thank you for your attention. If there is time for Q&A, I'll be happy to do that. If you don't get your questions answered, we offer something that's relevant to you. If you go onto our website at healthpromoting.com, and complete the registration forms, I offer you a no-cost phone conversation with me. I'll review your medical history. I'll give you my best advice. I'll direct you to somebody that can help you. We have an active telemedicine practice for doctors. If you want doctors that aren't idiots to give you advice, you can get access to them through Zoom. If you have somebody in your area, I can refer you to the people that I know that are doing worthwhile work, and I'll do my best to answer your questions and let you know whether any of this might be relevant to you. Thank you. few questions. So if you have a question, why don't you come down here? There's a microphone. You can ask your question so everybody can hear it. Come on down, ask your question. If you don't get your question answered during this time, I'm going to be outside at the booth. I'll be happy to answer questions out there as well. The website is right there. Yeah, well, you can go to TrueNorthHealth.com or healthpromoting.com. That'll all go to the same place. Whatever's up there on the screen. The fasting.org is the fasting compendium site with the research. TrueNorthHealth.com will get you to our site.
Most of your research is written on your program, but you touched a little bit on what sounded like intermittent fasting when
Yes.
you're 16 hours. Is there a benefit to that? Because your program sounds more supervised
Right.
versus a 12, 16, or X hour.
Right. So
What are the
we're
benefits of
experts
that?
in water-only fasting, the longer-term fasting. Walter Longo has been doing most of the research on intermittent fasting. And we've always used intermittent fasting for the last 40 years that I've been doing this. That means we limit the feeding window to about 8 hours a day. So you don't eat 3 to 4 hours before you go to bed. You delay breakfast, do a little exercise in the morning. You have an 8-hour feeding window. It helps people avoid overeating, and it gives you a 16-hour period of fasting that everybody can do regardless of their medical management safely. It's when we extend that 16 hours longer that we recommend supervision. So yes, we recommend that. How helpful is it? That research is kind of new. It's just being done. So we're not, we don't want to make claims we can't substantiate yet. And we're not actively researching that, so I'm not an expert in that literature. But you can look up Valter, V-A-L-T-E-R, Longo, L-O-N-G-O, or go to fasting.org because a lot of that work is cited there. And you can learn about that. That's really kind of a whole nother issue. Yes?
Okay, so on that note, would you say that fasting, intermittent fasting, how often would that be kind of from a healthy standpoint?
Well, the 16 hours, we recommend
those
you do that every single day just for the
just
next
like-
50 years. We're tracking people for 50 years at a time, and
I'm good with
so
that.
we want to do that, yeah.
Okay, but the other question I had was water. When you talk about drinking water when you're fasting, maybe 48 hours or whatever, what kind of water are we talking about?
Well, we always use just pure water. If you got rainwater that didn't have a polluted atmosphere,
Right.
it would be distilled water, and that's what we use. It's
so
fractionally
there's
distilled
no pH
water.
balance concerns, anything like that?
Any-
pH balance type of
Yeah, well,
number?
distilled
Distilled
water is
water
fine.
is-
What people are worried about minerals and things, but the minerals in water are not well absorbed. That's not where you get your minerals. There's more minerals in one apple than you're going to be getting
Okay.
from. So, and the problem with mineralized water is you don't know what else is in there.
Yep.
And so the only way to get reliably clean water is to either filter it or distill it. So we
Okay.
use distilled water.
Okay, good, thank you.
I would like to know why you recommend exercising in the morning before you eat.
So it turns out if your goal is to minimize excess fat, when you're fasted for 12 to 16 hours and you begin exercising, the weight that you're losing is preferentially fat. So it just helps with fat loss. If you're not worried about excess fat, you can exercise whenever you want to exercise. It's just an extra tool. And it's also a tool to get people delaying their feeding program so they can have an 8-hour feeding window. Okay, so exercising late at night sometimes can be overstimulating, interfere with people's ability to sleep as well. If that's not a problem for you, I don't care when you exercise, as long as you're getting vigorous activity throughout the course of the day. For a lot of people, not eating 3 hours to 4 hours before they go to bed and then exercising in the morning turns out to be a really effective pattern. I know I do that, and it works well for me. It works for a lot of people. If you want to do it a different way, that's fine.
Hi.
Hi.
My question about gluten.
Yes.
I'm not allergic to gluten.
Okay.
Is it healthy for me to eat gluten?
I don't think that today, if you look at wheat, which is a primary source of gluten for most people, the wheat that we eat today is a hybridized food byproduct that has nothing to do with the original wheat that people used to think about, where it would wave in the field. Now it stands straight up. It's got substantial, like twice as many genes as it used to have, and they get 10 times as much wheat per acre because of the manipulations that they've done. That glutinous grain is about a third of the population are clearly sensitive to it. People with Hashimoto's thyroiditis, people with irritable bowel, the joint, people that have arthritis oftentimes know it's an aggravating factor, and it's almost always served as a flour. If you just take wheat berries and boil them, not that appealing. You put it into a flour, you add salt, oil, and sugar, now it turns into bread, now you've got 1,500 calories a pound. Those flour products are why people are fat. So we're trying to get away from all those hyper-processed foods, and we eat rice, we eat quinoa, we eat millet. but we don't use gluten. Our books are all gluten-free. Now, can some people eat those products and not have a problem? Absolutely. There are people that don't seem to be, but it's so common, and it's almost always used in the form of fractionated foods that we've chosen to just exclude them.
I make my own bread with whole wheat flour,
Yes.
organic whole wheat
And
flour.
you don't use salt in that?
Little bit.
Oh, yeah, a little bit,
Little
just a
bit.
little bit. It's just a little bit. See, here's the problem.
Yeah.
Without the salt, what happens? It goes bad very quickly because salt's a powerful preservative. And what you're doing is you're taking this salty food and putting them into this microbe-rich gut that's supposed to have 1,000 strain of bacteria. Why do they use salt? To get rid of bacteria. What do you think it does to your gut microbiome? It's not friendly. So if you want to make bread without salt, it's still 1,500 calories a pound highly processed food, but it's without the additional chemicals that we add to it, it's not a very practical or desirable. It's just like cheese. If people eat cheese without salt, not so appealing. So it's really a carrier agent to get the salt, the sugar, the oil into people's faces. I recommend against it. Here's a simple solution. If you want to know if you should eat something or not, go inside yourself and get really quiet and ask yourself, do I really, 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 really want whatever it is? And if the answer is truly yes, you know. You can't have it. You get nothing.
I love my bread.
I know you do. And people love their cocaine, but what can I say?
So I cannot.
Okay. Thanks again for your attention. Anybody that's interested, I'll see you out there.
We want to thank Dr. Goldhamer for coming here to South Bend, Indiana, and enlightening our community with the value of water-only based fasting. And thank you for coming. And there's another speaker starting at 1, so come back.